You're tuned to Channels Television. It's time to switch gears as we talk health matters. A warm welcome to the program. I am Yomi Otaigbe. In a world where health challenges are ever evolving, disease prevention is one of the key factors to achieving optimum health and well-being. Today on the show, the conversation will be on why disease prevention matters and how we all can go about achieving it. A public health specialist joins me in a moment. But don't forget, you are also an integral part of this program. When is that time? You can join us via phone on 080-8054-2233, on X at Yomi_Otaigbe, or via email at omotaigbe@channelstv.com. To stay with us on Health Matters. I'm now being joined on the program by a public health specialist who is the managing director of Dr. Ameyo Stella Adadavo, that is the Health Trust, Mrs. Niniola Williams. She's a passionate person that is very passionate about reducing the burden of preventable infectious diseases and increasing health security through interdisciplinary approaches. Thank you so much for joining us.
Thank you for having me, Yomi.
So let's talk about what disease prevention entails. Let's start that way.
Yeah, so disease prevention is really about the small everyday actions that we can all take to ensure that we're stopping preventable illnesses and sicknesses. We understand the impact that these things have on units, family units, on communities, and on the nation as a whole. So when we talk about disease prevention, we're talking about the simple things, from washing your hands before you eat. I know many of us wash after, but actually it's more important to wash before you use your hand to put food in your mouth, right? So washing your hands, keeping your environment clean, making sure that waste is not a challenge in your community, ensuring that you're taking care of one another, ensuring that we're vaccinating ourselves and our children. These are some of the things that disease prevention entails. Different ways and strategies of ensuring that germs are not spreading between human beings and across communities.
Okay, so let's take it level by level. So you've mentioned some of them already. Let's take it primary prevention in terms of the environment, or we're starting with immunization.
Yeah, immunization is a challenging element in Nigeria. We know a lot of vaccine hesitancy. People don't want to give their children vaccines and things like that. But we also know that the burden of vaccine preventable diseases in the country is huge. So vaccination is such a core and critical way that we can stop the spread of diseases at a population level. Because vaccinations, for example, are not just about protecting myself if I vaccinate myself. By taking a vaccination, I'm also protecting the people around me. There's something we call herd immunity, which is what happens when a significant number of people in a community or in a place have been immunized against a disease. It means that that disease is going to be much harder for that disease to actually infect people. So immunization is not even just an individual action. It's actually something that contributes to our collective health.
Okay, so vaccination is very key. Now let's talk about disease prevention itself in terms of the spread of diseases. How do we go about, nipping that?
There are many different strategies we can use, but I'll just highlight some of the most important ones, right? So the first is making sure that we have clean hands and clean environments, clean spaces. It's sort of that primary level, what each individual person can do. I know that people think, hand washing. When Ebola was around, we did it. When COVID came, we did it. But it should actually be a routine thing that we do consistently. When you look at the impact of it in terms of the cost, it's low. The effectiveness is high. So hand washing is a key element. And then keeping our environments clean, ensuring that we're living in hygienic places, whether we have maybe a market stall that we're in charge of or a home. We should ensure that those places are clean, that waste is not a challenge, because we know that waste can be a breeding ground for a lot of germs that will now enter our spaces and inevitably infect people around. So that's one element. Another one is food and water. We underestimate how many diseases spread via poor food sanitation and unclean water. These are challenges that can be solved. Again, these are all preventable things, but we need to be aware of the sources of our water. We need to be, if you're a Zobo seller, for example, where are you getting your water from? How do you ensure that your customers are not going to fall sick? For those who are local food vendors, and for those of us who like to patronize those local food vendors, can we ensure that the sources of those materials that are being used to make the food are quality? Can we ensure that the food is being cooked properly and thoroughly enough to kill infections? And then can we also do our part on an individual basis to take care of our bodies? I think we also underestimate the fact that our bodies are capable of fighting infections. However, our bodies need to be in a good state. We need to be eating well. We need to be resting. We need to be exercising. So can we start also doing some of those things to make sure that even if we do get ill, our bodies are able to overcome those germs and infections? So those are some of the ways we can be very practical in this thing we call disease prevention.
And where is the place of detection of diseases early in terms of disease surveillance and making sure that, this disease that may be springing up somewhere is quickly nipped in the bud?
Yeah, it's a huge element, as you've just said, right? So when you think about it, it comes down to health education. If people are aware of certain signs and symptoms they should look out for, both not just within themselves, but also among the people around them, then that's when we now start seeing that things are being detected early enough to prevent their spread. It's very, very important that we do mass communication at the community level, at the grassroots level, to ensure that people know what they should be worried about and how, more importantly, how they should react. If I'm suddenly having a fever or I'm coughing and there's blood, what do I do? Where do I go? What should I be wary of? And what do I need to know? So it's very, very important that that early detection is supported by engaged and educated communities.
And managing the disease itself when it is eventually found. Let's talk about that part of it.
Yeah, so that's another element of disease prevention, which is not in the homes and communities, but in the health facility itself. So when, a patient comes in suspected of tuberculosis or any other infectious disease, or even just a more common infection, diarrheal disease, for example, we need to ensure that that person gets the quality treatment they deserve and gets healed while not also spreading the infection within the health facility, which is sometimes what we see a lot of due to lack of poor infection control measures at the health facility level. You end up having germs that get spread through the environment in the health facility, which is now contaminated with the germs of the patients that are there. So ensuring that our health facilities also are able to deliver quality and safe care, protecting both health workers and patients, is an essential element as well.
Now, when we talk about those at the forefront of disease prevention in Nigeria, I'm sure the name Dr. Stella Adadevoh will ring a bell. We all know what she did in terms of making sure that the dreaded COVID-19 infection did not spread so far in the country. And in the light of that, DRASA Health Trust was inaugurated to honor her. How is DRASA, contributing its quota in terms of propagating the message of disease prevention?
Yeah, so we take a three-pronged approach to disease prevention. We believe that working with the grassroots and working with the government and connecting them together is the most effective way to get disease prevention systematized across the country, from homes all the way up to policies and states and the nation as a whole. So for us, we take it in three levels. The first is we are training health workers. My aunt, Dr. Adadevoh, and 3 members of her team died because their health facility was not prepared or equipped to handle the Ebola virus. And so we are working with health workers across the country, 15,000 so far, to make sure that that doesn't happen again. Make sure that health facilities are places of healing and not harm, that people can go there and confidently get the care they need, the treatment they need, and infections will not further spread in those environments. We're also working at community level because you can't just leave it for the health facility alone. So in the communities, we're training health champions. That's what we call them. They're everyday people, butchers, artisans, transport workers, market women, people that we engage and equip and train to be able to not just identify infections and report to the local authorities, but also be the voice of this disease prevention we're talking about in their communities, educating people, making sure that people are changing their behaviors to stay healthy and prevent the spread. And we've trained over 96,000 of those. And we don't just leave it there either. We're working with the government, like I said, on policies and systems to make sure that there's an enabling environment for all of these things to work well.
Okay, let's talk about that part of you as DRASA working with the government, how much of this, is the government putting effort into this in terms of your work with government?
It has grown a lot over the years. Initially, after Ebola, there was a lot of celebration that we did well. We contained it as a country. But we also have to keep reminding and advocating for the fact that there are still gaps remaining. Nigeria is a very complex country, and disease prevention is very complex. When you look at the elements that cause infection, it's not just what humans are doing. It's the air, it's the water, it's the animals around us. There's so many elements that are involved. And so over the years, we've been able to grow our relationship with government, different ministries and agencies, and expand the work we are doing to support their mandates. Because ultimately, government can't do it alone. No matter what we say, we can sit down and wait and say, oh, government should do this and government should do that. But rather, our approach is how do we join hands with them and get these things done faster and effectively. So for us, it's been really encouraging to see how the government has prioritized this over the years. It continues to get more and more attention. I think things waned a bit after Ebola, but, COVID came and showed us that, wow, we shouldn't really rest on our laurels. And beyond the Ebolas and the COVIDs and the Lassa fevers, there are everyday infections that are killing people in this country. A study by UNICEF some time ago showed that 296 children under 5 are dying every day from diarrhea, simple diarrhea infection, which can be treated. But for many reasons, either they don't have access to the health facility or they don't have the finances. This tragic ending is what we now see. And so how do we prevent that from happening in the first place? That is the key that we are trying to contribute towards.
Just mentioned everyday infections, and diarrhea is one of them. What are those things that an individual can do that would predispose them to diarrhea, for example? And you can mention some other infections that, simple disease prevention measures can help to safeguard.
Yeah, it's challenging when you talk about diarrheal infections because of how they spread. Sometimes it's by the water and the food that we consume. And so we need to be very careful about the people we patronize. The zobo seller, the kunu seller, the person who's selling amala by the side. How do we ensure that we are patronizing places that prioritize hygiene? And that's also where our work with government comes in, because we're able to work with the government to look at how do we establish food safety systems at state level, at LGA level, at even ward level, to make sure that these vendors also know that there's a standard they must uphold. So for those of us who are the consumers of these things, it's our responsibility to be sure that we're accessing food through vendors that are trusted and who over time we know provide quality food. And we know in communities, you'll hear that, no, that person, if you go there, you may not be okay afterwards, but this one is okay. So we tend to know the reputation of some of these sellers. So it's important that we keep that in mind. And then within our homes where we cook and consume things on our own, it's very important we prioritize food safety as well. Washing our vegetables and fruits, cooking our meats thoroughly, making sure our food is served hot, making sure we use tight containers to keep our food stuff secured from insects and rodents, ensuring that we have clean water and we boil our water to, remove any impurities. These are some of the practical things we can also do.
And I want to talk about the part that, in terms of surface cleaning, we've talked about the environment. In the environment, of course, also include our home, inside our homes. Let's talk about the surface cleaning, but I think that will be after the break. We're going to just take a very quick break now and be back on Health Matters. You're watching Health Matters on Channels Television, and it's that time for you to also join us in this conversation. We're talking about disease prevention. The number to call is 080-8054-2233, or you send your message or comment to Yomi_Otaigbe on X, or to our email, omotaigbe@channelstv.com. So we were talking about surface cleaning just before we went on that break, how important it is for us to also clean the surfaces, the tables and things like that, because I know some time ago we were talking about hepatitis, and it's been said that that virus could linger for a long time on the surface. Let's talk about how important it is for us to take care of our surfaces.
Yeah, it's an essential part of it. We talk about cleaning our hands, but cleaning the surfaces is equally important, because our hands are the tools we use for everything we do. We touch and engage with the world through our hands. So if we're in an environment where our surfaces are contaminated, it's very easy for us to pick those germs from those surfaces and unfortunately expose our bodies to them. So it's very important that we keep the environment clean, we keep the surfaces clean, that we ensure that we're disinfecting from time to time. And the most important thing to remember is you want to focus on the surfaces that are most important. I know we like to mop and sweep the floor. It's important. But germs cannot jump from the floor into my mouth or into my eye. Rather, what about that door handle that I'm going to use my hand to touch at least 15 times in a day? Have I wiped it before? Have I cleaned it? And this applies not just even for our homes, for our workplaces, for public spaces like banks and malls, for marketplaces. It applies definitely in health facilities. We always encourage them when we're working with them that prioritize those high touch areas, the light switches, the door handles, the places that people are going to interact with. I'm sure many of us watching today, when was the last time we cleaned maybe our TV remotes? Certainly we turned on the TV to watch this program today. When was the last time that piece of equipment in our homes was cleaned, right? These are the things we need to look at and prioritize for disease prevention.
And that hospital part of it, I think we should stay a bit more on it. We've seen how infections sometimes would be, circulating even within the health facility. And, there are protocols to follow in terms of how to handle patients. We may want to just remind our healthcare workers about that.
Yeah, I think that's a very good point, Nomi. Thank you. Infection prevention and control is something that we should be teaching in medical school, in nursing school, in midwifery school, so that when people graduate and become health workers, even in pharmacy school, right, in all the allied health programs, we should be teaching it so that when they graduate and enter the workforce, it's already ingrained in them that these things need to be done. But since we're still working towards that major change as a country, there are many other things that are happening in the short term. There are policies and legal frameworks that have been released to show that hospitals now are accountable for infection control. It is a key element of the service delivery that they are providing. They are not meant to be providing healthcare in the absence of infection control systems and practices.
Just hold your thoughts, please. Sorry.
The health facility workers.
Sorry, please. We have been joined by Ibrahim from Akwa Ibom. Let's quickly take Ibrahim. What's your question or comment?
Okay, please, I just want to...
Hello, Ibrahim.
Used to be so comfortable.
Oh, I think the network is in the way. I can't hear Ibrahim well. Maybe you should just try again. Sorry, you can go on, please. Complete your thoughts there.
No problem. Thank you. I hope Ibrahim can rejoin. So I was saying that these systems need to be in place in health facilities to ensure that health facilities can deliver care in absence of infections that are preventable. Health facilities are places where there are lots of germs. Sick people are there. So how do we ensure that these facilities have everything in place to prevent the spread of infections? And that's where infection prevention and control comes in. So everything from the waste management system in the facility to the hand washing of the health workers themselves, to the cleaning staff. It's also very important. Sometimes we think it's only the doctors and nurses and the clinical health workers, but no. In fact, the cleaning staff and the administrative staff of any health facility also have a huge role to play in ensuring that the entire environment is not a breeding ground for germs. And so putting in those IPC systems, hand hygiene, sanitation, environmental cleanliness and surface cleaning, ensuring there are routines and systems that are followed by every member of that health facility so that when patients come in, they are safe. And also so that the health workers themselves don't pick infections from the hospital, get sick, or take it home to their families. These are the essential things.
All right, I think we've been joined by another person, Mrs. Umar from Akwa Ibom State. Go ahead, please. Oh, wow. I really can't hear her.
Hello, I'm here.
Oh, okay. Go ahead, please.
I'm hearing you. Yeah. Okay. Enjoy your program. I'm happy. Disease prevention. There's something I wanted to point out. It used to be if you have one case of typhoid, it was We
Well,
have
I'm
typhoid
trying to
everywhere.
piece together what you're saying, but I really can't hear you well.
I'm talking about typhoid.
Okay, what about typhoid?
Typhoid in those days, in the 70s and 80s, in the 60s, 70s. If we have one case of typhoid, it was concern for everybody. But now we know that typhoid is everywhere. If somebody has malaria now and goes for test, the result will come out as malaria typhoid. It was not so in those days. So we have to find out. We have to find, is it from the water? Is it from the food? Is it from the food vendors?
Okay.
It was not like this before. It's a concern. It's really my concern.
Okay. I think Mrs. Umo is concerned about typhoid. I really can't piece together all of the things that she said, but it's one of those things that we are going to take up or treat in the coming weeks. Thank you so much. Mrs. Niniola, it's time to go, but in closing, what would you say, that one word you want to leave with us, or a phrase, just to say one thing we shouldn't forget about disease prevention?
One thing we shouldn't forget is that it starts with us. Disease prevention is a team sport. It requires everybody's participation. It's not like we can sit back and relax and think somebody else will take care of it. Just like with a football team, you can't have a striker without a goalkeeper. In the same way with disease prevention, we cannot have individuals and communities working without the government. So we have to all work together to get this done. And we've seen progress, and there's a lot of hope across Nigeria now.
Thank you so much for your time today on the program. I've been speaking with a public health specialist who is the managing director of Dr. Ameyo Stella Adadavo Health Trust, Mrs. Niniola Williams. Thank you so much once again for your time.
Thank you.
And good news coming from Kenya as the country eliminates sleeping sickness as public health challenge. This and more on our health news segment.
Nigeria has recorded a 46% decline in various poliovirus cases so far in 2025 compared to the previous year.
I've vaccinated 83% of children we targeted.
And that's according to the Executive Director, Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Muyi Aino. He made this known in Abuja during the second quarter 2025 review meeting of a Northern Traditional Leaders Committee on Primary Healthcare Delivery. Dr. Aino also noted progress in high-burden states such as Kano and Katsina, where infections dropped by 85% and 84% respectively. He stated that between April and June 2025, over 71% of planned settlement were reached during campaigns, rising to 78% in June, while vaccination coverage increased from 81% to 84%. Addressing the issue of fake finger marking by health workers during routine immunization, Dr. Aino said the agency is making efforts to tackle the challenge. He added that through the collaboration with the Northern Leaders Committee, over 54,000 children who failed to receive any immunization have been reached across prioritized wards in 100 local government areas in the country.
We still have clusters of our Nigerians, our fellow Nigerians, who have doubts about these vaccines. For whatever reason, they reject it. They are not compliant when the vaccinators go to them. So one of the things that the traditional leaders do with us is they set up what they call resolution teams. We're reporting up to 80%, 84% resolution of non-compliance. What we want is that there's even no non-compliance at all. The incidence of fake finger marking is reducing, but our ability to actually detect it and respond to it is also increasing.
The Sudanese capital, Khartoum, is struggling with an increase in cases of dengue fever disease during the current rainy season. The country's health ministry said in the past week 723 new dengue fever cases were recorded along with 2 deaths. Since the start of 2025, there have been over 6,000 cases and 9 total deaths. Hospitals are said to be overcrowded, with patients, including children, arriving for checkups and treatment, while other scenes reveal piles of uncollected rubbish mounting in the streets. Local media outlets report that accumulation of waste in neighborhoods and public areas has worsened the reach of mosquitoes, the main carriers of the dengue virus. The Director of Infection Control at the Ministry of Health in Khartoum explains that the epidemiological situation has deteriorated further since the war. The World Health Organization has validated Kenya as having eliminated human African trypanosomiasis, or sleeping sickness, as a public health problem, making it the 10th country to reach this important milestone. Human African trypanosomiasis is the second neglected tropical disease to be eliminated in Kenya. The country was certified free of guinea worm disease in 2018.
Submissions are open for tomorrow.
Congratulating the government and people of Kenya, the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, said this is another step towards making Africa free of neglected tropical diseases. Human African trypanosomiasis is a vector-borne disease caused by the blood parasite Trypanosoma brucei. It is transmitted to humans through the bites of tsetseflies that have acquired the parasites from infected humans or animals. Rural populations dependent on agriculture, fishing, animal husbandry, or hunting are most at risk of exposure.
And that's Health Matters for this week. Thank you so much for watching. I am Yomi Otaigbe.